Welcome back to the Move Better Project. Today, we're going to go over a very simple but very powerful exercise for those of you who experience pain in your neck, tension headaches, all that kind of stuff. All you need is foam roller. Stay tuned, and I'll show you how to do it. Most neck pain, tension headaches, upper cervical dysfunction, whatever you want to call it, really comes down to a postural defect that we call forward head posture. I'll show you what I mean from the side. If you look at my head and I sit up nice and tall, there's a little bit of extension in my cervical spine and there's a little bit of flexion in my thoracic spine up here. Those curves, however, in most people who spend a lot of time sitting, especially over a computer, especially if you work on a laptop, which pulls you even further forward, look at your phone, whatever, all the things that we do in our modern society, the head gets pulled forward, thus forward head posture. What that actually means in practice is that I have excessive flexion in my upper thoracic spine, so that gets stuck in a more flexed position, which then, because my head is in front, my lower cervical spine is still carrying out that flexion, that same pattern. And then to have my head not be just looking down, I have to have upper cervical up here, extension. So forward head posture is really flexion here in the upper thoracic and lower cervical spine. And then there's an inflection point where it turns around. It depends on the person. Usually it's like around C4, C5. Then it switches to extension. It causes all kinds of problems. One of the most common is tension headaches. And people get these headaches that wrap around in this pattern around their head when they spend too much time at their desk, sitting over their computer, whatever. And that is because the suboccipital muscles, which are right here at the base of the skull, where the skull connects to C1 and C2, those muscles get really tight. There's a nerve called the suboccipital nerve that passes through a couple of them. Pressure increases on that nerve, and then we get that familiar tension headache. So what do you do about it? Well, if you're in this situation, really, ultimately, you're gonna have to correct that posture, but that's gonna be a whole project, and there's gonna be lots of videos on that that I will put out. But if you're in pain, you gotta do something right away, and we gotta fix the biggest issues. So we have excessive extension in the upper cervical spine. So that means that the muscles on the back of my neck are going to be tight. The muscles in the front of my neck, which a lot of people don't even know that you have, are going to be weak. There are two muscles called longus capitis and longus coeli that are on the front of the cervical spine. So behind your throat, there are muscles there that work to flex the upper cervical spine. If those muscles are weak, I'm going to be more likely to be in this forward extended upper cervical posture, whereas if they're strong and active, I'm going to be more likely to be in this flexed upper cervical or neutral posture, and I'm going to be less likely to have pain. And in fact, it's quite well researched when it comes to neck pain that people who don't have neck pain tend to have stronger deep cervical flexors, what we call those muscles, than people who do. What do you do about it? You get a foam roller, and we're gonna work on, at the same time, doing a little chin tuck head nod exercise that's gonna stretch out these tight muscles in the back and strengthen or activate these weak muscles in the front. So here we go. So I'm in position here. I've got the foam roller right at the base of my skull. And that's gonna be higher than you probably think. You probably think base of my skull is about here, but actually at the back, it's up here. There's a little ridge here called the external occipital protuberance that you can feel, and just below that you can actually feel the base of the occiput at the back of the skull. So that's where I want the foam roller to go. I'm going to place it right there, okay? And then the exercise is so simple. What you want to think about is an axis going through your ears right here, and that I'm going to rotate my head around that axis and return it. Now I'm talking while I do this. When you do this, it's best if you put your jaw in a resting position. So that means teeth together, lips together, tongue on the roof of your mouth. You'll just do all your breathing through your nose. So anyway, the exercise itself, again, I'm going to tuck my chin, which really occurs like lifting the back of my head in this direction, or sort of I can help myself out even a little bit by sort of pulling up and over on the back of my skull. Now it's pretty easy here where you're in the upper cervical spine because there's less load on this side of the fulcrum. But the key to doing this right, if you want to use the deep cervical flexor muscles that we're trying to strengthen, is to not have this muscle here, which is called sternocleidomastoid, kick in. Now you got to be careful. I'm going to tell you to palpate that muscle for a contraction. If you push hard on both sternocleidomastoids, you can activate something called a baroreceptor reflex in your carotid artery. Your blood pressure can drop and you can pass out. So be very careful with that. So I'm just going to feel very gently with a finger and a thumb on my sternocleidomastoid muscles, which are these ones that stick out when you do that and get really mad. So I can feel what those feel like when they contract. But you can do that chin tucking movement by using those sternocleidomastoids, but that's not going to be effective. We want to use the deeper longus colli, longus capitis muscles. So I just feel there for a contraction, and I'm going to do my chin tuck and back. It's not going to feel super intense. If your suboccipital muscles are really, really tight, this might feel intense, but probably not going to be that hard in the upper cervical spine. Now, you may find you get to a range of motion like, I can't quite get past there, my sternocleidomastoid kicks in, back off, and you can actually use your fingertips here in sort of this old school 1950s sit-up position and just gently help yourself. And you only want to help as much as you need to be able to accomplish a movement without using sternocleidomastoid. And I want to do that on this spot until I can start to feel those muscles loosen up a little bit. And then I'm just going to move down. And we're going to go from the top all the way down to, again, about C4 or C5, but you can just think of that as the just a little more than halfway on the neck. Okay, so again, doing my chin tuck exercise, I can feel I'm keeping my SCMs relaxed, so that's great. If I need to though, I can just help out a little bit and add my fingers. You can hear my voice change when I get into that fully chin tuck position because I'm actually changing the shape of my airway. These muscles are right behind your airway. So when they contract, it changes the shape of your pharynx and larynx, and then my tone gets a little more, I don't know, like local news broadcaster. Hi, I'm Sam Martin. So we just work your way down. Now, as you get lower, the leverage increases because more of your head is on this side of the foam roller. So you're gonna have to help out a little bit. Unless you're really strong. If you're really strong, your neck probably doesn't hurt. But again, I'm just making sure I'm not kicking in with those muscles in the front, helping out a little bit if I need to. Working my way down, and you can spend as little or as much time as you want doing this. It's pretty low intensity, but when you start to feel the muscles in the front, so just behind your windpipe or your throat, start to get, there should be like a burn in there, like they're working. And if you're like most people, they're going to be pretty weak, so it won't necessarily take that long. When you start to really feel that burn and muscle fatigue, then you can take a break. And hopefully, once this little nub here, for some people is C6, for some people it's C5, for some people it's C7, but it doesn't matter. That's basically the bottom of the cervical spine. So once you feel the foam roller kind of pushing against that nub, you're past where you need to work. So we just kind of want to focus on that upper cervical spine. So there you have it. Basic exercise to lengthen or stretch out these tight muscles on the back top area of the neck that lead to neck pain and tension headaches, while strengthening the deep cervical flexors in the front, and doing that without using sternocleidomastoid. I didn't even really mention earlier, but sternocleidomastoid, when that muscle gets tight, if you can think, it attaches back here to the mastoid process at the base of the skull and comes around to the sternum and clavicle here, sternocleidomastoid. When that muscle contracts, it actually just pulls me directly into forward head posture. So that's why it's important that we don't use that and we do use the deep cervical flexors. All right, give it a try. Let me know how it goes in the comments. Make sure you're subscribed to the channel, and we'll see you next time.